Why are heart attacks happening more often? Causes, risk factors, age, warning signs, and how to protect your heart. Have you ever wondered how someone who looks completely healthy can suddenly suffer a heart attack? Maybe you've heard about someone in their 40s, 30s, or even younger who suddenly experienced serious heart problems. And that raises a very important question. Why are heart attacks happening? Are they only a problem for older people? Or can a person in their 30s or 40s also be at risk? And perhaps most importantly, what can we actually do to lower our risk? In this video, we're going to break down what causes a heart attack, the major risk factors, why heart problems can happen at younger ages, what symptoms you should never ignore, what foods can support better heart health, and the lifestyle changes that can help protect your heart. This video is for education and awareness. It is not a personal diagnosis or treatment plan. If you have concerning symptoms, especially symptoms that could indicate a heart attack, seek emergency medical care immediately. So let's start with the most important question. What actually happens during a heart attack? Your heart is a powerful muscle that works continuously every minute of every day. It pumps blood throughout your body, delivering oxygen and nutrients to your organs, muscles, and brain. But here's something many people forget. The heart itself needs blood and oxygen too. The heart receives that blood through special blood vessels called the coronary arteries. When those arteries become narrowed or blocked, the heart muscle may not receive enough oxygen. And when blood flow is suddenly reduced or completely blocked, part of the heart muscle can become damaged. That is what happens during a heart attack. One of the most common underlying problems is coronary artery disease. Over time, fatty deposits and cholesterol can build up inside the walls of coronary arteries. This buildup is called plaque. As plaque accumulates, an artery can become narrower. But there's another important danger. Sometimes a plaque can rupture. When that happens, the body may form a blood clot around the damaged area. If the clot blocks blood flow through the artery, the heart muscle downstream may suddenly be deprived of oxygen. That's when a heart attack can occur. So although a heart attack can seem like it happens out of nowhere, the underlying artery disease may have been developing silently for years. And that's one of the biggest reasons prevention matters. You don't want to wait until the day your heart gives you a warning. You want to understand your risk before that happens. Risk factor number 1, high blood pressure. One of the major risk factors for heart disease is high blood pressure. Think of your blood vessels as a network of flexible tubes carrying blood throughout your body. When blood pressure stays too high over time, it puts additional stress on those vessels and on the heart. The problem is that high blood pressure often doesn't cause obvious symptoms. A person can feel completely normal while their blood pressure is elevated. They may go to work, exercise, eat, sleep, and continue living normally. But that doesn't mean everything inside the body is normal. That's why checking your blood pressure regularly is so important. Don't wait until you feel sick. Know your numbers. And if your blood pressure is consistently elevated, talk with a qualified healthcare professional about what it means for you and what steps you should take. Risk factor number 2, high cholesterol. Another major risk factor is unhealthy cholesterol levels, particularly elevated LDL cholesterol. Cholesterol itself isn't simply a bad substance. Your body needs cholesterol for important functions, but having too much LDL cholesterol in the bloodstream can contribute to plaque buildup in the arteries. Over time, that plaque can narrow the artery and increase cardiovascular risk. And here's why cholesterol can be dangerous. You may not feel it. You don't necessarily get chest pain because your cholesterol is high. There may be no obvious warning. That's why knowing your cholesterol levels can be important, especially if you have other risk factors such as diabetes, high blood pressure, smoking, obesity, or a family history of heart disease. Risk factor number 3, smoking and tobacco. Smoking is another major cardiovascular risk factor. If you smoke, don't think of it as only a lung problem. Smoking can also damage the cardiovascular system and increase the risk of heart disease. Tobacco exposure can contribute to problems involving blood vessels and blood clotting, and that's why quitting smoking is one of the most important things a smoker can do for their overall health. The same principle applies to other forms of tobacco. If you use tobacco, don't simply accept it as part of your lifestyle. Consider getting professional support to quit. You don't have to do it alone. Risk factor number 4, diabetes. Diabetes is another important risk factor for cardiovascular disease. When blood sugar remains too high over time, it can contribute to damage throughout the body, including the blood vessels. And diabetes often doesn't exist by itself. A person may have diabetes along with high blood pressure, unhealthy cholesterol levels, excess body weight, and physical inactivity. When multiple risk factors occur together, overall cardiovascular risk can become more concerning. That's why managing diabetes isn't only about watching your blood sugar. Your overall cardiovascular health matters too. If you have diabetes or have been told that your blood sugar is elevated, talk with your healthcare professional about your individual risk and what monitoring is appropriate. Risk factor number 5, overweight and obesity. Another important factor is excess body weight, particularly when it is associated with metabolic problems. Being overweight or obese can increase the likelihood of conditions such as high blood pressure, diabetes, and unhealthy cholesterol levels. And those conditions can all affect cardiovascular health. But here's an important point. Getting healthier doesn't mean you have to transform your body overnight. You don't need to starve yourself. You don't need extreme diets. And you don't need to spend hours in the gym every single day. For many people, sustainable changes are more realistic. Improve your diet, move more, reduce highly processed foods, get enough sleep, and work toward a healthier weight gradually. The goal is not perfection. The goal is progress. Risk factor number 6, not moving enough. Modern life has made physical inactivity extremely common. Many people sit at a desk for hours, then they sit in a car, then they sit on the couch, then they spend more time on their phones, and before they know it, most of the day has passed with very little movement. Your body was designed to move. Regular physical activity supports cardiovascular health and can also help with weight, blood pressure, blood sugar, and overall fitness. The American Heart Association generally recommends that adults aim for at least 150 minutes of moderate intensity physical activity each week, or 75 minutes of vigorous activity, depending on the person's health and abilities. That doesn't mean you have to become a professional athlete. Walking can be an excellent place to start. Take the stairs when appropriate. Walk after meals. Stand up regularly if you work at a desk. Find activities you actually enjoy. The best exercise is often the exercise you can consistently maintain. If you have an existing heart condition or other medical concerns, talk with your healthcare professional before starting a new exercise program. Risk factor number 7, an unhealthy diet. Now let's talk about food, because what you eat every day can influence many of the factors that affect cardiovascular health. A diet that is consistently high in saturated fat, excess sodium, added sugars, highly processed foods, and excessive calories may contribute to an unhealthy cardiovascular risk profile. On the other hand, a heart-supportive eating pattern can include plenty of vegetables, fruits, whole grains, legumes, nuts, seeds, and lean sources of protein. So what should you actually eat? Let's make it simple. Start with vegetables. Try to make vegetables a regular part of your meals. Leafy greens, tomatoes, carrots, broccoli, peppers, beans, and other vegetables that you enjoy. Then add fruit, apples, oranges, berries, bananas, melons, or whatever fresh fruit is available to you. You don't need one magical fruit. You need a healthy overall eating pattern. Legumes such as beans, lentils, and chickpeas can also be useful sources of nutrients and protein. Whole grains can replace some refined grains. Nuts and seeds can be included in appropriate portions, and fish can be part of a heart-healthy dietary pattern. The American Heart Association's current Life's Essential 8 framework emphasizes an overall healthy eating pattern built around whole foods, fruits and vegetables, lean protein, nuts, seeds, and healthier cooking oils. What foods should you limit? This doesn't mean you can never eat your favorite foods again. The goal is balance. But if your everyday diet is dominated by deep-fried foods, heavily processed snacks, sugary drinks, excessive sweets, and foods high in sodium and saturated fat, it's worth making changes. For example, instead of drinking sugary beverages every day, choose water more often. Instead of eating fried foods at every meal, choose baked, grilled, roasted, or steamed options more frequently. Instead of relying heavily on packaged snacks, try fruit, vegetables, unsalted nuts, or other nutrient-dense options. And pay attention to portion sizes. A food doesn't automatically become healthy just because it has a healthy label. The entire dietary pattern matters. What about salt? Sodium is another important issue. For some people, consuming too much sodium can contribute to higher blood pressure. And high blood pressure is an important cardiovascular risk factor. The tricky part is that sodium doesn't only come from the salt shaker. A lot can come from packaged and processed foods. So read food labels, pay attention to sodium, and try to make fresh, minimally processed foods a larger part of your meals. What about sugar? Excess added sugar can also make it easier to consume too many calories and may contribute to poor metabolic health. That doesn't mean you can never eat dessert. It means dessert shouldn't become the foundation of your diet. The same principle applies to soda and other sugary drinks. If you're drinking them several times a day, reducing them can be a meaningful lifestyle change. Can garlic, lemon, honey, or one special food prevent a heart attack? This is where misinformation becomes dangerous. You may see videos claiming that one particular food, drink, herb, or homemade remedy can clean your arteries or completely prevent a heart attack. Be careful. There is no magic food that guarantees protection from a heart attack. A healthy diet can support cardiovascular health, but it does not replace appropriate medical care. If you have high blood pressure, high cholesterol, diabetes, or another medical condition, don't stop prescribed treatment because someone online recommended a natural remedy. Lifestyle and medical care can work together. They are not necessarily alternatives. Why are heart attacks happening at younger ages? Now we come to a question many people are asking. Why are we hearing about heart attacks in younger people? First, we need to be accurate. Heart attack risk generally increases with age. Older adults remain at greater overall risk of cardiovascular disease. But younger adults are not automatically protected. Risk factors can develop earlier in life: high blood pressure, high cholesterol, diabetes, obesity, smoking, physical inactivity, poor diet, and family history. These factors can affect cardiovascular health long before someone considers themselves old. The CDC and American Heart Association both identify multiple, modifiable cardiovascular risk factors, including high blood pressure, unhealthy cholesterol, smoking, diabetes, obesity, physical inactivity, and poor diet. So a 35-year-old shouldn't think, "I'm young. Heart disease isn't my problem." Age matters, but risk factors matter too. If you're in your 30s or 40s, this is not a reason to panic. It's a reason to become informed. Know your blood pressure, know your cholesterol, know your blood sugar when appropriate, know your family history, know your weight and waist measurement, and understand your lifestyle. The earlier you identify unhealthy risk factors, the earlier you can work on them. Family history matters. Some risk factors cannot be changed. You can't change your age, and you can't change your genetics or family history. If a close family member experienced heart disease at a relatively young age, tell your healthcare professional. That information can help them understand your overall risk. But family history doesn't mean your future is predetermined. There are many lifestyle and medical factors you can potentially improve. That's the encouraging part. Does stress cause heart attacks? Stress is another topic people often ask about. Stress is a normal part of life, but chronic stress can influence health and may also make healthy behaviors harder to maintain. For example, someone under constant stress may sleep poorly, exercise less, smoke more, eat more highly processed foods, or drink more alcohol. So instead of thinking about stress as one magical cause of heart attacks, think about the bigger picture. Your mental health, sleep, activity, diet, and other habits are connected. Finding healthier ways to manage stress can be part of taking care of your cardiovascular health, Don't ignore sleep. Sleep is another major part of overall cardiovascular health. If you're constantly sleeping only a few hours a night, your body isn't getting the recovery it needs. The American Heart Association includes healthy sleep as one of its life's essential 8 measures for cardiovascular health. So make sleep a priority. Create a consistent sleep schedule. Reduce unnecessary screen time late at night, make your bedroom comfortable, and aim for an appropriate amount of sleep for your age and individual needs. What are the warning signs of a heart attack? This may be the most important section of the entire video because preventing a heart attack is important, but recognizing one quickly can also save a life. One of the most common warning signs is discomfort in the center of the chest. It may feel like pressure, squeezing, fullness, tightness, or pain. It may last for several minutes. It can also go away and come back. But chest discomfort isn't the only warning sign. A person may experience pain or discomfort in one or both arms, the back, neck, jaw, or upper abdomen. They may become short of breath. They may feel lightheaded. They may sweat heavily. They may experience nausea or vomiting. And symptoms can vary from person to person. Women may also experience symptoms such as unusual tiredness, nausea, shortness of breath, or discomfort in areas such as the back, neck, or jaw. The key message is simple. Don't wait to see if the symptoms go away. If you think you or someone else may be having a heart attack, call 911 immediately. The American Heart Association emphasizes that getting emergency medical help quickly can be life-saving. Don't waste valuable time searching online for the perfect explanation. Don't assume it's just indigestion. Don't assume it's just anxiety. And don't wait for the pain to become unbearable. Get emergency help. So, how can you lower your risk? Let's bring everything together. There isn't one magic solution. Heart health is about the combination of many small decisions. First, don't smoke. If you smoke, make a plan to quit and seek professional support if you need it. Second, know your blood pressure. High blood pressure can exist without obvious symptoms. Third, know your cholesterol. Ask your healthcare professional what your numbers mean for your personal risk. Fourth, pay attention to blood sugar. If you have diabetes or have been told that your blood sugar is high, take it seriously. Fifth, move your body. Aim for regular physical activity that is appropriate for your health. Sixth, build a healthier diet. Eat more vegetables. Eat fruit. Choose whole grains. Include beans, lentils, nuts, seeds, and appropriate protein sources. Choose healthier fats more often, and reduce highly processed foods, excessive sodium, added sugars, and unhealthy fats. Seventh, maintain a healthy weight. You don't need perfection. Consistent improvement matters. Eighth, get enough sleep. Make sleep part of your health routine. Ninth, manage stress. Find healthy ways to handle pressure and protect your mental well-being. And 10th, get appropriate medical checkups. Don't wait until something feels seriously wrong. Regular preventive care can help identify important risk factors before they become bigger problems. The American Heart Association's Life's Essential 8 approach focuses on 8 major areas of cardiovascular health: eating better, being more active, quitting tobacco, getting healthy sleep, managing weight, controlling cholesterol, managing blood sugar, and managing blood pressure. One final message. If there's one thing I want you to remember from this entire video, it's this. A heart attack may happen suddenly, but many of the factors that contribute to heart disease develop over time. That means you don't have to wait for a crisis before you start taking your heart seriously. You can start today. Take a walk, eat a healthier meal, drink more water, cut back on sugary drinks, reduce highly processed foods, stop smoking, check your blood pressure, know your cholesterol, pay attention to your blood sugar, improve your sleep, and talk with your healthcare professional about your personal risk. And remember, being young does not mean you're invincible. Being thin does not automatically mean your heart is healthy. And feeling fine does not guarantee that your blood pressure or cholesterol is normal. Some of the most important cardiovascular risk factors can exist silently. That's why awareness matters. Prevention matters. And knowing your numbers matters. But there's one more thing that matters even more: knowing when to act. If you suddenly develop chest pressure or pain, shortness of breath, discomfort in your arm, shoulder, back, neck, jaw, or upper abdomen, or other concerning symptoms such as nausea, sweating, or lightheadedness, don't ignore it. Call 911. Minutes can matter during a heart attack. Your heart works for you every second of every day. So don't wait until your heart is in trouble before you start taking care of it. Protect it with your daily choices. Know your risk factors. Know your numbers. Stay active, eat better, don't smoke, get enough sleep, and seek medical help when something doesn't feel right. Because when it comes to heart health, prevention isn't about being perfect. It's about making better choices consistently and starting before the emergency happens. Take care of your heart today, because the best time to protect your future is before a heart attack ever happens. This video is for general educational purposes only and is not a substitute for individualized medical advice, diagnosis, or treatment.